suffering from chronic pain? Are you coping with a condition like fibromyalgia, osteoarthritis, or chronic back pain and feeling afraid to exercise? Is exercise actually the last thing in the world you feel like doing right now? Hi, my name is Jeanette DePatie, aka the Fat Chick, and I'm a plus-size certified fitness instructor who's helped hundreds of people of all ages, shapes, sizes, and abilities learn to love their bodies and love exercise again. Welcome to episode 6 of the Right Now Show. Today, I'd like to meet a request submitted by one of our viewers. Carolyn says, "You know what's better than a Fat Chick blog post? A Fat Chick video! I will be watching with rapt attention. I can't wait to see where you are headed, Jeanette." A topic that I would really love to see covered is fitness for people with chronic illness or disability. I have fibromyalgia, and I'm a fat chick myself. I have yet to come across any type of exercise or fitness information for fibromyalgia that isn't weight loss focused. Thanks for the nice note, Carolyn. I think a lot of people have questions about exercising with chronic conditions and chronic pain. So let's talk. Dealing with chronic pain is hard. I mean, really hard. And for many of us, exercise is the last thing in the world we feel like doing. But although it may feel like a bad idea, exercise is actually one of the very best tools for helping us lessen pain symptoms and improving our quality of life. Now, that doesn't mean you should go out this week and try to run a marathon. You can exercise safely and effectively when coping with chronic pain or chronic disease, but you have to do it the right way. Before I say anything else, let me remind you that you need to work with your doctors to come up with a plan that will work for you. If you haven't seen your doctor in a while, well, you're going to need to do that first. Then you need to follow any special recommendations that your doctor, physical therapist, orthopedist, surgeon, or other medical professional has given you about what kinds of exercise are okay for you right now and what kinds of exercise you should avoid. Sometimes it's helpful to ask that medical professional to write you an exercise prescription that tells you what you should or should not do. Once your doctor has cleared you for exercise, I think the next step is to learn to understand and gauge your pain. I like to use the analogy of a traffic light to help you with your pain. Now, green light days are the good days. These are the days that you feel relatively pain-free. These are also the moments during a workout where you feel your body working out but aren't really experiencing any pain. Green means all systems go. So, by all means, continue your workout. Yellow light days are average days for people coping with chronic pain or disease. You'll feel pain at levels that are pretty normal or average for you. You may feel a generalized ache that becomes slightly more intense as you work out. These might also be the moments during your workout where your body starts to talk to you. Now, as long as your body is talking, whining, moaning, or complaining, but not screaming or yelling, you can continue with your workout. Just proceed with caution. Red light days are flare-up days. You may feel pain that is far more intense than is usual for you. This might also be a moment during your workout where you feel a sharp or intense pain. Red light means stop. Wait. Assess. If you're having a serious pain flare-up, you might want to wait until your symptoms level off or normalize somewhat before you proceed. And if you experience a red light moment during a workout, you need to stop. If the pain subsides or normalizes, you can probably continue at a lower intensity. But if the pain does not subside or normalize, you might just need to wait for another day. Once you've assessed your pain level, you can start prepping for your workout. Make sure that you're current with all your regularly prescribed anti-inflammatory or pain medications. Some people also find it very helpful to warm their bodies with a bath or hot shower before they work out. It's also a good idea to work out in a warm environment, so you might want to turn up the thermostat, or if you're exercising in the pool, make sure that the water is relatively warm. When you start to exercise, move gently. Start with gentle stretches that take your joints through their full range of motion, or as much as you can tolerate that day. Warm up for 5 to 10 minutes before you start any other kind of exercise. You might find out that after your warm-up, you're not really able to proceed with any other form of fitness. That's fine. Pay attention to your traffic light. Remember, if you hit a red light, stop, wait, and assess. Continue slowly and gently through your workout, keeping an eye on the traffic light. Proceed when you feel like you can. You might find it helpful to ice any painful areas after your workout. Again, this might feel like the last thing on earth you want to do, but ice can help minimize inflammation. It's important to understand that your exercise program needs to be tuned to your body, your needs, and your situation. That probably means doing a little less than you think you should be able to do right now. It means starting very small and proceeding very slowly from there. Ultimately, it's important to remember to listen to your body and take it easy. Patience is your friend. It's way more important to do a little today and a little again tomorrow than to do a whole lot today and then quit. But if you find a way to move forward slowly, gently, and persistently, you'll see rewards. You may find your pain easier to manage. You may find yourself sleeping better, and you'll probably experience an improved quality of life. Carolyn, I hope these tips are helpful for you, and I hope that all of you out there can begin your journey to less pain and a better quality of life through exercise right now. For more information about chronic pain and exercise, see the links below. And if you have a question you'd like to see me answer on the Right Now show, just write it in the comments section or send me a private message. And if you're enjoying the show, don't forget to subscribe. So, my dears, until next week, mwah!